What is a root canal? Every tooth has a soft inner core called the pulp, and the pulp is where the nerve and blood supply to the tooth live. When the pulp becomes infected from a deep cavity, crack, or trauma, it can cause pain and swelling. A root canal removes the infection, cleans and disinfects the inside of the tooth, and then seals it so you can keep your natural tooth. Over 15 million root canals are performed each year in the United States, and when done properly, they're over 95% successful. Now, what are the signs you might need a root canal? Here are the most common signs: lingering pain with hot or cold, especially if it lasts more than 10 seconds, throbbing or constant aching when chewing, swelling in the gums or a small bump near the tooth, kind of like a pimple, or if the tooth darkens with time. But here's the thing. Up to 30% of infected teeth have zero symptoms. That's why regular x-rays and checkups are so important, so we can catch it before the symptoms begin. Because let's face it, it's going to start hurting at the worst time, like a Friday night or a weekend when you can't find your dentist. Now, what happens during the root canal procedure? First, we completely numb the tooth just like for any other treatment. Then we remove the infected pulp and clean the canals. Once clean and disinfected, we seal everything with a rubber-like material called gutta-percha. And depending on the location of the tooth or how much healthy tooth remains, we may place a crown to protect the tooth and seal it up even further. The whole thing usually takes about an hour to an hour and a half and is usually done in just one visit. I've had a root canal myself, and I can honestly say it was just like having any other treatment done. What hurt was the toothache that came before. That infection in the pulp, it won't go away. You can take antibiotics and it might help short term, but the source of the problem is the pulp, and the pulp has to be removed. The infection can spread into the bone, into the sinus, or even into the bloodstream. Over 8,000 people in the United States end up in the hospital each year because of untreated dental infections. And in rare cases, it can become life-threatening. Are there alternatives to root canals? So what if a root canal isn't the right choice for you? Or maybe the tooth is too damaged, we may need to remove it. Then you're looking at a few options: a dental implant, a bridge, which requires grinding down healthy tooth structure on the neighboring teeth, or a partial denture, which clasps around the other teeth and it has to be removed daily. These are all valid options, but if we can save your natural tooth, that's usually the best route, both biologically and financially. Sometimes, despite our best efforts, a tooth just can't be saved. When that happens, the next question is, what's the best way to replace it? In this next video, I'll walk you through your options: dental implants, fixed bridges, and removable partial dentures. And I'll explain why one of them stands out as the gold standard. Click the link now to watch. I'm Dr. Kelly Vaughn. I hope you found this video helpful, and I look forward to seeing you again soon.